Hi there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this edition of Integrative Movement Insider, and I'm here in Scottsdale, Arizona. I'm about to go pick up Janice from the airport because we're here to do our 3-day Integrative Corrective Exercise Instructor Certification Program. This program was created specifically for those individuals like you that work with the active aging population. And actually my good friend and colleague Jackie Bachmeyer is on, and she has been through this program, and she uses the integrative movement system, our proprietary approach that we created to work with our own active aging population in our clinic. She uses this with her population down in Houston, Texas at Evolution Fitness and Wellness, and she does an excellent job, and she sent me lots of testimonials from her clients that have really worked well and have success using this approach. So Jackie, thanks so much for all you do and all you do for our industry as well as your colleagues as well. As we've been talking about, this is Active Aging Week. So October 1st through 7th is Active Aging Week. And this is an opportunity to encourage our active aging population, both your clients that work with you, but also their friends, family, and colleagues, to become more active, to really be proactive in their own healthcare and to be advocates for themselves. And I'm preparing a talk for next year, a keynote speech that I'm giving about the importance of healthcare through fitness. And as a fitness professional, you are the front line of offense for helping these individuals, empower them, educate, and give them strategies for helping them take back their health, take control of their health, and really change the landscape of the healthcare system. So thank you for all you do. Thank you for being on and allowing us to be part of your journey. So on Monday, I was speaking about the fundamental movement patterns. So we talked about the squat. Tuesday, we came back and we were talking about the hip hinge pattern and why those two patterns are so important to your active aging population. Now today, I'm back here to talk about pushing patterns. Tomorrow, we'll talk pulling patterns. But one of the things we hear quite frequently in the industry, and I was told this from day one when I first started to develop my own shoulder problems, rotator cuff tears and labral tears in both shoulders, was you're tight here, you need to stretch out here in the front, and you need to squeeze back and retract your shoulder blades, retract and depress them. And I got really good at retraction and depression. And guess what? That's the very reason that led to my rotator cuff tears and labral tears in both shoulders, and why now I've limited overhead range of motion and also have weakness in overhead motion, because that's what happens when you tear your labrums. So many of our clients have been told not to do pushing patterns because that's leading to the forward shoulder position. So I want you to ask you something. Do you actually assess your clients? Because if you're not assessing your clients, you don't actually know if that's what they need. Do they need more retraction and depression, or do they need actually more control of upward rotation and posterior tilt? Because that's the position your clients need to control. That wrapping of the scapula around the rib cage, the shoulder blades must come around the rib cage. So do this with me right now as you're watching this. What's up, buddy? My buddy Pete is on and watching as well. So we used to work out together, so he understands a lot of what we went through early on in our lifting career that led to some non-optimal and inefficient posture and movement habits. So do this with me right now. Squeeze back and down with your shoulder blades. Do you have any trouble with that? Now, when you go back with your clients today, ask them to do the same thing. Do they have trouble squeezing back and down? And the answer is most of the time, 99% of the time, your clients do not have any problems reaching down and back or squeezing down and back with their scapula. Now, let me ask you to do this for me. Now, take your arms and reach straight up overhead. So just go up overhead, and you can see I have very limited range of motion overhead. I'll do that one more time. Go overhead, and I get about 150 to 160 degrees of shoulder flexion. So my age and my activity level, I should have closer to 180 degrees. So because of rotator cuff tears and labral tears, I've lost a lot of range of motion. Now ask your clients to do the same thing. So let me ask you, if they have no trouble with retraction and depression, and they have trouble bringing their arms overhead, what do they need more of? Do they actually need more ability to learn how to protract and get their shoulders overhead, or do they need more scapular retraction and depression? And the answer is they need a better strategy for getting their scapula to wrap around and be stabilized upon the rib cage. They don't need more retraction and depression. Yes, they need to know how to control their scapula better in a retracted and depressed, I shouldn't say not retracted, depressed. They need to control their shoulder blades better as they're moving their shoulders, but they don't need to strengthen retraction and depression. So one of the first things we do in the corrective exercise strategy we'll teach this weekend in our certification course and that we use with our clients is we use our Rolga. The Rolga is an excellent tool because that will allow me to release where our clients are most tight, and it's actually not their chest. Sometimes, yes, pec minor, but what they really need to do is release underneath their shoulders. So the lat attachments, their teres major, their infraspinatus. So they need to release back here, put the Rolga back here between the scapula and the humerus, and then they'll do the release work there first. Then we'll teach them how to do supported positions, because the hand feeds into shoulder stability. And if they're not training the hand and the hand and wrist position, they're going to lose a lot of their scapular ability to stabilize their scapula. I'm going to step away from the camera and demonstrate what that looks like. The quadruped position is an excellent position to train scapular stability. Now, I understand that many of our older clients can't get down into the quadruped position very well, so we'll use the supported position against the wall. So like a supported hip hinge and a quadruped sit back, or should say supported hip hinge with a sit back, to teach them how to stabilize the scapula. I'm going to do it on the grass out here, but this will be the same exact pattern we use with our clients against the wall or against a massage table. It begins with alignment of the head, neck, and thoracolpelvic cylinder. Then I'll go into the pattern and demonstrate what it looks like. So the quadruped pattern really feeds into what you need to do with all your planking patterns, your push-up patterns, because it's the ability to wrap the scapula around the rib cage to create that upward rotation and posterior tilt of the scapula and to align that thoracolpelvic cylinder. It feeds into our down dog and also into our push-up patterns. And that's what you really need to train in your clients, not more scapular depression and retraction. So I hope this video helped explain why you need to do more teaching of upward rotation and posterior tilt, how to teach your clients how to control their scapula, and more importantly, how to use the right progressions to help your clients successfully and safely achieve their health and fitness goals. So I'll be back tomorrow. We'll discuss pulling patterns and how do you actually train retraction and depression without over retracting and depressing the scapula, which again leads to a lot of shoulder problems. So thanks again for allowing me to share this information, for being on. Appreciate you and all you do for our industry, and more importantly, for our active aging population. Get out there, share your message, and empower your active aging clients to be proactive in their own healthcare. Make it a great day, and we'll see you tomorrow live from Integrative Corrective Exercise Instructor Certification Program. Take care.